AM 650.
Doctor, now can you tell me what ailing me? Doctor, you said
Yes, indeed. All you really need is a good doctor. And if you got problems in your mouth, if you have dental concerns, I suggest you call our good friend, Dr. Bobby Bird. Did you like that tune?
Yeah.
Doctor.
It's a good tune.
It's not bad. I've actually got some special doctor tunes for you for the rest of the show to play.
I'm looking forward to
See
it.
if you like those. You're listening to Boomer Life right here on AM 650 Radio. Good morning. I'm Tom Lucas. Our very special guest in studio this morning is Dr. Bobby Birdie of BC Perio. And you guys are just doing a marvelous job down there. You've got locations in Vancouver and Coquitlam.
Absolutely.
If somebody wants to come to your Vancouver office, where do we find you?
We're on the corner of Broadway and Willow in the 777 West Broadway building. There's a great Chinese restaurant that everyone knows in that building, and it's a great place to be. So, yeah, we're on the 5th floor.
Easy to find.
Absolutely.
And you're also out in Coquitlam.
That's right. We're right next to the Coquitlam Center, just off of Glen and Johnson, and it's a great place to be. We like it.
Mm-hmm. Now, let's suppose I'm brushing my teeth tonight, and I'm looking in there, and I'm seeing stuff. I'm going, that doesn't look too good. Should I be giving you a call? How do I know if I should go and see you, Bobby?
I would say that it's just a matter of if you want your questions answered and you're wondering if what you need to have done and all those things, you're more than welcome to come in for a consult. Yeah,
and what I like too at BC Perio is you do have free consults.
Absolutely. So the consultation that we do when someone calls in and for implant consults, a lot of times they're free. Absolutely.
Last segment of the show, we were talking about CT scans.
Mm-hmm.
They're complimentary as well. That's all part of the...
It is. It's part of all of our CT scans in the office when they're part of the implant consultations are free. Absolutely.
And why is a CT scan better than just of an X-ray?
So an X-ray is like a 2D image. So imagine taking like a photo of you. It's kind of a 2D image, right? A CT scan is an image that's three-dimensional on a computer. So I can see not just how big you are overall, the volume, but I can also see through you and see all the little tiny slices. So it's a great way to be able to see how everything is going, how much bone there is, where the anatomy is, and it allows us to plan something on the computer where we can specifically pick how big the teeth are going to be, how long the implants are, how big the implants need to be, and really plan something basically perfectly on a digital sense.
Somebody comes in, they go, well, this sounds great, CT scan, it's free. I like to save myself some money, but you know what, Bobby, I'm terribly afraid of radiation.
Sure. The two scan machines we have right now are the two lowest right now that you can buy. So the one in Vancouver, actually, we were the first ones in the country to get it. It's the lowest radiation in the world, and it's about only 5 microsieverts, which basically means that it's next to nothing. It's less than basically 2 normal dental x-rays.
Oh, fantastic.
You get more radiation from your cell phone throughout the day.
Really?
Absolutely.
Well, they say don't put your cell phone in your pocket, but that's another show and another doctor, so we won't go there right now.
Sure.
But I do have something special for you right now. On the telephone line, we have Mary Ann. And Mary Ann is the wife of one of your patients. Mary Ann, good morning.
Good morning. How are you, Tom?
I'm wonderful, and thank you for volunteering to do this because I know that your husband Barry is out playing handball or something.
He's playing squash.
Squash.
And I think feeling very confident that Dr. Birdie's going to get to the root of the matter, if I may.
A little pun there.
And deal with the issue that he's been dealing with for 1 year.
Well, Mary Ann, tell us about your husband Barry. What made him finally decide to go see Dr. Bobby Birdie?
He has had for the last, and it is actually a year in August, he's had problems with his back molars, and he's seen a number of dental professionals and really hasn't had any relief. He's taken medications, he's taken antibiotics, et cetera, and those are stressful on your body. So it was time to really get down to the root of this matter. So he heard an interview that you had with Dr. Birdie, and he decided to make that call. And he's actually really happy he did because Dr. Birdie is going to do something about this. He's used the machinery that you're talking about, the scan, and he's found a hairline little fracture or crack or whatever that is, and he's going to deal with it, and he'll have relief. And I'm happy for my husband because it's been quite unpleasant.
Well, I want to say, first of all, thank you to you, and thank you to Bobby, and thank you to the gods up in dental heaven for making him listen to our show to call Dr. Bobby Birdie.
That's right.
What was he like before the dental solutions started to take place? Was he a tough guy to be with? Was he in pain all the time?
Well, he wasn't. He's a really nice guy. So he's really tried to weather this storm and, tried to do all of the recommended types of, procedures that the doctors have recommended. So he's really tried hard to do all of it. And, 2 weeks, 3 weeks, and it always seems to, turn into another 3 weeks or another 2 weeks, and it's just never, ever there's never been any good result. We ended up going on a family vacation in December, and he was, he was really in pain, and he was very stoic about it and didn't ruin, there were about 6 of us on the trip, and he didn't ruin anybody's holiday because he's just that kind of guy. He just took it and kept thinking, okay, I'm going to do this, and then that's going to happen, and it's going to get better, and it never did, and it hasn't to this point. So, yeah, this is a real relief for him. I was so happy for him too, because now he can see that he'll get better and he will feel better. And, you'll enjoy life much more when you're feeling just 100% rather than this nagging, aching in the back of your mouth.
Life is no fun when you're in pain.
Oh, it's a challenge then, and he coped very well, but he does, if you don't have to cope with that, if there's a relief, if there's a way of managing this, like Dr. Birdie is going to do, it's so much nicer. He's lucky that he can have it managed. That's what I'm happy for.
You're nodding your head?
Yeah, absolutely. It's Barry's a great person. I remember Barry specifically. I just saw him this past week, and he's just he's just a great guy. He's one of those guys that said, I understand, and he's followed all his instructions, and it's one of those things where it's not an easy thing to find all the time, but we're happy we did, and I think it's going to be good for him to get this matter taken care of. Absolutely.
Marianne, do you have children?
Yes, we have. We have 4 kids.
Can I ask what age group are they?
Oh, they're old. They're in their 30s and early 20s or late 20s.
You come on, you don't have kids in your 30s.
No way.
No way.
They're right up there.
Really?
Yeah.
Did you start when you were 10?
Our oldest daughter is going to med school, so we've got, she sort of changed her mind at one point, but now she's there, and so we're, very happy for her. But no, we've got them way up there, so it's great. And what Dr. Birdie was saying about Barry, he's a very, nice guy, and he's really tried to follow all the instructions along the way, and it's just not worked. And he's tried to change his diet and tried to really, he eats pretty clean anyway, but really clean everything up, and nothing was working, and nothing was working. So this has just been such a relief to have this, going to happen for him. So I'm very thrilled for Barry.
That's really a cool story. The reason why I asked about your children is because I wanted to know if your kids had found the difference in Dad after his treatment.
Well, Brooke, one of my girls, said, "Oh, Dad, he just seems so much more lighthearted now that he knows this is going to happen for him. He knows, there's a really conclusive diagnosis here. You have a better outlook. You know that you're going to get this help. It's going to change something, and it's going to be good. It's nice."
It's like the old expression, there's light at the end of the tunnel.
Absolutely.
Yes, that's exactly right, Tom.
Well, that's fantastic. Well, that's a great story, and thank you for sharing that with us.
Oh, you're welcome.
Say hi to your kids. Wish is it your daughter is going to become a doctor? She's in the medical field?
She is, yeah.
That's great. Congratulations.
She's in school right now as we speak, so yep.
What does she want to do with her career? What kind of doctor does she want to be?
Well, she's a PhD right now, and now she's going to do she's going to become a medical doctor. So
I see.
I'm really thrilled for her.
That's a shame because I thought we could have got to know each other, but unfortunately, it's wrong. Don't like doctors. I like Dr. Bobby Birdie. I like dentists. You know what I'm saying?
Yes, yeah. No, she's not going that route.
It's too bad. Well, it would have been nice to have the opportunity to meet her, but que sera, sera. I'm just kidding.
Exactly.
Just kidding.
Thank you very much, Dr. Birdie. I really appreciate what you're doing for my husband. I'm very pleased for him.
Thank you so much, and it's my pleasure, and it's our job, and it's what we want to do. So I'm looking forward to treating Barry. It's gonna be great.
Good. I'm happy that I could express this to you and through the radio. It's really it's been a pleasure.
You told a great story, and we appreciate your time, Marianne. You enjoy the rest of the summer.
Thank you very much, Tom.
Thanks for being with us.
Take care.
You bet.
Bye-bye. What a great story.
Yeah.
What a great story. Holy cow. It's not even your patient. It's the patient's wife.
Well, you know what? It's funny. It's a lot of times the patients, it's not sometimes the patients, a lot of times the patients' kids or the patient's parents that come in and say something. I've got a lot of patients where they're a bit older, they're denture wearers, or they've got a lot of things going on. And like her, which I can't believe she's got kids in her 30s. She sounds like she's 30, so
Really, no
it,
kidding.
it's amazing. But she for her, like I've got a lot of patients where, like even today, we saw a patient who got teeth in one day last week, and she came in, and her mom is, the patient was in her late 70s, and she got the work done, and it's her daughter who's just so happy about it. She's like, I can't believe we waited this long. She's so happy. She's relieved from pain and issues and problems with her denture, and not only just that, she feels better. And it's one of those things where she'll come in and she's such a great little lady, and she'll say, "Oh well, now I'm having a little bit difference in chewing, or I'm different." Well, it's because you've got fixed teeth. You haven't had them in 30 years, so it's going to take you more than a couple weeks to get used to having fixed teeth. So, but she's just happy, and that's the best part of it.
Last time we were together, you were telling me that not only do you have some patients in their 70s and 80s, you have them even older.
Yeah, we've got a couple patients in their 90s. We've placed implants in patients that are in their 90s, and I love those patients. You know why? Because I really feel that that's the way it should be. Why do you got to feel like you got to, I've got 1 foot in the grave or something stupid like that? Do you know what I mean?
Yeah.
We want to make sure that we're doing what we can and living life the way we can right now.
Are these people getting their teeth fixed in their 90s because they're dating online? Or
You know what? You'd be surprised. People date a lot older than you think. Absolutely.
All right, we've gone to that end of the spectrum. What about the other end? How young can somebody be before they come to see you?
Well, we see a lot of younger patients. We don't see a lot of younger kids, but we see patients in their teen years. We saw a patient like that last week. A lot of people that are getting braces and having orthodontics, and they need tissue grafts or they need implants afterwards. We see them after that, of course. But implants we've got to wait till someone's finished growing till we can do implants, of course.
You mentioned other treatments such as bone grafts and nasal lifts.
Oh, we do bone grafts and different types of grafts as well that we need, soft tissue grafts, aesthetic stuff. We've got so many lasers in the office that I don't even know how to name all of them. It's great. We've got Tim Gould in the office, who's just a laser man. He's amazing at it, and I use a lot of lasers. So does Dr. Zokol. So we're able to do a lot of laser therapy in terms of removing kind of blemishes and problems that when it comes to just things that are aesthetic, but also for periodontal disease and for a lot of tissue diseases as well.
I like doing this show with you because I can get a lot of free advice. So we go back to my wife again, who's listening to this show. She goes, "Oh, please don't stop talking about me." But you did a lot of work on her. You did a bone graft, I think, and a nasal lift.
Was it a sinus lift? Yeah.
Sinus lift, sorry. And she said to me, she said she's going to ask you, and I believe she did. She said she can actually smell better now.
Well, it's a lot of times. It's funny. That's a good question. A lot of times when people have work done, and sinus lifts are a very predictable procedure. They are a larger graft, but it's a very predictable procedure. A lot of times when we get into the sinus, it's we're opening up the area, and a lot of times things are congested or they have a slight chronic infection that needs to be cleaned out and worked on and worried about. So a lot of times we do feel people have relief, and the reason being is because we've done something to get them to go in there and relieve it. Absolutely.
Well, she told me she enjoyed her time with you in the office, even though she can't remember most of it.
That's fine. It's fine. Absolutely.
So again, people come to see you. You do your magic on them. You fix their teeth. They feel no pain.
Yeah, well, I think that we try our very best to make sure that we minimize the pain altogether. Zero pain is a lie overall. I think anyone that's like saying, "Oh, this happens 100% of the time." That's not true. I say that we try our very best to make sure that we minimize the amount of pain for everyone, and I think we do a darn good job at it.
Well, I think that probably during the procedure there's no pain.
Absolutely.
Afterwards, there might be a little bit of pain, but that's natural.
That's
right?
natural. We did something.
Yeah.
Absolutely.
Something that's foreign to the person's body.
Absolutely, it's different.
And just a second ago, I talked about your follow-up care, and with us, your nurse phoned in the evening a couple of times.
Yep.
And then you phoned the next day?
Well, it's our, like I said, we want to make sure we do good work, but we also want to make sure that people are taken care of. That's the best thing. Is that the worst thing is to have something done and then feel like you're not gonna, because it's amazing. I give out my cell phone number to a lot of patients because I want them to call me if they have a problem. They never call me. They call the office, they call people because they're like, I don't want to bother the doctor on the weekend or worry about it and this and that, and I get that. So I try to make sure that I call patients to make sure that
How come you never gave me your cell number?
Well, you already have it, don't you?
Oh, that's, well, yeah, okay. Where are your clinics located? In Vancouver and Coquitlam, but what are the addresses?
The one in Coquitlam is 1175 Johnson Street. It's on the corner of Glen and Johnson, right next to the Coquitlam Center.
Okay.
And then the one in Vancouver is on Broadway and Willow. It's in the 777 West Broadway building. We got a great view, and it's a state-of-the-art clinic.
And there's parking downstairs at that location?
Yeah, parking downstairs. Absolutely.
And if you get there early like we did, you can park on the street.
Absolutely.
That's right, and watch the trees blowing in the breeze.
That's right.
Yeah, you gonna stick around for a while?
I will.
All right, you're listening to Boomer Life on AM 650 Radio. It's Tom Lucas, and our guest in studio this morning is Dr. Bobby Birdie, and we'll be back to talk about your teeth in just a moment.
It's all about the baby boomer lifestyle. Boomer Life on AM 650.